We're glad to have special guest Dr. Ronald Alverez, who's a member of the Ear, Nose, and Throat Institute, and he has special skills that I want you to know about. He takes care of most people's procedures and surgeries in the office as opposed to going to the hospital or the operating room. Glad to have you, Dr. Alverez.
Thank you for having me. It's a pleasure.
Yeah, Ron has been in town now how many years?
12 years.
12 years in a transplant from Jersey,
Yep.
right? Okay, you said New Jersey. You've got me saying
Jersey. It's
So
Jersey.
Jersey. Yeah. That reminds me of a joke that would be inappropriate right now, but anyway. But it's a great thing to have Dr. Alverez as one of our partners because he brings a skill set because of his passion for taking care of patients and delivering for them medicine the way they want it delivered, and that is efficiently, high quality, lower cost. So when we talk about in-office procedures, one thing that comes to mind that I know that you're really good at is treating people that snore. So
Yes,
what's the innovation in treating snoring that is different from the past? And on the program we have talked in the past about sleep studies and CPAP and weight loss, but you do something very particular. Tell us about it.
Yeah, we do a couple of different things for snoring. One thing that we do is for patients with just primary snoring without sleep apnea, there are two procedures that we offer in the office. One of them is called radiofrequency ablation, which is essentially an in-office procedure done under local anesthesia, kind of like a dental procedure, and all it involves is using a special wand that goes into the back of the throat, shrinks down the excess tissue, and by doing that, it allows for less excess tissue in the back of the throat. It creates less vibration, and that improves snoring.
Is it good for obstructive sleep apnea?
It is for very mild sleep apnea. It's not really a procedure that's indicated for more severe sleep apnea. For more severe sleep apnea, we have a couple of options.
And let's tell people a little bit about sleep apnea. That means while you're sleeping, you stop breathing because your airway is closed.
Exactly.
You're unable to move air, and that is not snoring. I mean, that's worse.
That's exactly right. That's snoring is simply noisy breathing. Obstructions, or what we call hypopneas, are periods where either the breathing stops or dramatically slows for a period of time. And that up to a certain point can actually be normal, but when it gets beyond about 5 events per hour, we call it sleep apnea. There are some in-office ways that we can control that. One of the most kind of popular ways that people have been talking about a lot recently is radiofrequency ablation of the back of the tongue, or tongue-based ablation. And that, again, is another procedure that can be done in the office. It can be done under either local anesthesia or with mild sedation. Very minimal downtime. People usually can go back to their normal activities within a day or two. And it has been shown to be effective for people with sleep apnea.
And how long would it take somebody to undergo this procedure? And then how long would it be before you
It's about a 10-minute procedure. The results can take up to 6 weeks, though, because when you create that little scar in the back of the tongue, it takes a while for that scar to mature and shrink the tissue down. So it's not something that you'll see overnight, but it like I said, usually about 6 weeks. Sometimes we do have to repeat it depending on the volume and the bulk, but it has been shown to be pretty effective, and a lot of patients are looking at that as an alternative to more traditional treatments.
Yeah, and so people really like to avoid that machine, the CPAP
Yeah,
machine.
CPAP has a bad has a lot of bad connotations to it, but seriously, it is the most effective treatment for sleep apnea. So we only really recommend surgical intervention for sleep apnea in people who fail CPAP. But believe me, there are a lot of people
of those out there
that
feel it.
Yeah.
And they feel like they have no choice or no alternative but traditional surgical techniques.
There are other options out there, but again, like I said, we always try CPAP first, and if they're not able to tolerate it, then we can have those discussions. Lifestyle modifications are huge in sleep apnea: weight loss, good sleep habits, avoiding sedatives, those kinds of things, alcohol. All those things can make your sleep apnea worse. So it's very, very important that people, take a serious sort of holistic look at this and try and treat it on multiple levels.
Well, I think it's a great innovation. I'm glad that you're here to talk about it. But it's not the only thing that you do.
No, we do a lot of in-office procedures. We're offering what's called transnasal esophagoscopy, which is an effective screening exam for people with chronic reflux. Very commonly, we see patients who come in with a chronic cough, a lump in their throat, those kinds of things. And a lot of those people suffer from reflux. The concern about chronic reflux is the risk of esophageal adenocarcinoma, and that cancer can be screened for with transnasal esophagoscopy, which is, again, a very quick in-office procedure. It's just done with topical anesthesia. We can even do biopsies with a little brush, and we do DNA testing on that, on the biopsy, and we can actually get some very good information. So in someone who doesn't want to take the time to undergo a more complete anesthetic and miss work time and that kind of thing, this is something that can be done in the office, and they can drive themselves home.
Once again, we're talking to Dr. Ronald Alverez of the ENT Institute. You hit on so many things there. You've got a lot of knowledge about this. But this transnasal esophagoscopy is, I tell my patients, it's esophageal screening. We're looking for esophageal cancer and treating conditions that a lot of people don't notice. And in fact, one of them would be a chronic cough.
That's exactly right. Yeah.
Tell our listeners a little bit about why that's reflux.
Well, in some people, what can happen is if they reflux high enough, the acid and digestive enzymes and bile salts can actually go up into the back of their throat and cause chronic irritation. And most people will manifest that as a persistent cough or tickle in their throat. Typically, it's worse after meals or at night. And those people usually should be evaluated because, again, like I said, chronic reflux is associated with esophageal cancer. So we typically recommend an evaluation. Also, one of the diagnostic procedures we can do, again, in the office to evaluate that is oropharyngeal pH probe monitoring, which allows us to measure the acid levels right at the back of the throat over about a 24-hour period of time, and that also helps either support or refute that diagnosis.
So basically, you can diagnose whether acid gets into the back of the throat and nose.
Absolutely, yeah.
And
we have a dry pH probe that can measure. The old probes used to only work in a wet environment, and the thing that makes this one so neat is it actually can work in a relatively dry environment like the back of the throat. It doesn't have to be underwater the whole time. And because of that, it can sit right in the area where the symptoms are, and that allows for very accurate diagnosis of what we call LPR, which is laryngopharyngeal reflux, as opposed to gastroesophageal reflux.
Well, it's a special area that we
it's
as
got
ENTs
its own word,
deal
yes.
with. Well, and now we travel up a little bit from reflux to the nose. So reflux can affect the nose, and there
Absolutely.
are innovative things you're doing for the nose in the office.
Absolutely. Nowadays, in people who with certain types of sinus problems, we can treat most of those in the office under local anesthesia. Balloon sinuplasty has been around since about 2005, and essentially, instead of cutting the openings to the sinuses, we can use a little balloon that can dilate the sinus. The balloon does not stay in. It's removed right after the procedure. Again, it's kind of like a dental procedure. We just numb up their nose with a little topical anesthetic and then do the procedure, and most people can drive themselves home. And it's been shown
That's
to
amazing.
be, it's been shown to be about as effective as traditional sinus surgery in the involved sinuses. It doesn't work for every case. It doesn't work for every sinus. It doesn't remove polyps. But in those patients who have the right criteria and the right set of symptoms, it is as effective as sinus surgery. Absolutely.
And what's great about it, they don't have OR costs.
Exactly. It's cheaper for the patient, no OR, no anesthesia, and no loss of work, no downtime.
I mean, and that's the key. I think that patients nowadays, as they should, need to expect more from us as physicians and as a practice.
Absolutely.
And, having this technology, being able to deliver this to the public is important, but it's important and they know about it. And, of course, that's what the show's about.
Yeah, it's a great option. And, until 2011, when this was opened up to be done in the office, it's something that I've found so many patients very excited about, and it's a great option to avoid a trip to the operating room.
And so how long does it take you to do this procedure in the office?
It depends on the number of sinuses involved and the anatomy, but in general, it's usually about a 20 to 30-minute procedure.
Wow, so they can drive themselves to the office.
Yeah, absolutely.
But that's true for all the things you've talked about.
All the things
this
I talked
morning.
about, with the exception of the tongue ablation. That's one procedure that it's a good idea because sometimes we do need to give a little bit of sedation. But for the most part, most of these things, can be done in the office. No downtime, drive yourself home. Absolutely.
And then in many cases, just like having the esophageal screening, the transnasal esophagoscopy, they can go back to work that
Oh,
day.
that day, absolutely.
I mean,
Yeah,
you come
no
dressed for
problem there.
work, come in, have it done, and leave, as
Absolutely.
opposed to our.
We do nasal endoscopes all the time as ear, nose, and throat doctors, and this is just basically an extension of that. And I've had nasal endoscopes done on me 50, 60 times. I've had my esophagus evaluated, and it's really no big deal.
Right, it isn't. It really isn't. Well, thanks for bringing all these to us today.
Sure, happy to be here.
Glad to have you. Hope you'll come back.
Absolutely.
You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.